Hello, my name is Trina Rose Teresa Fox, and today I'll be performing this skill video of administering an intramuscular injection. The 6 rights of medication administration are right patient, medication, route, dose, time, and documentation. Verify the provider's order. We are to administer 6 milligrams of morphine. The vial states that there is 4 milligrams per 1 milliliter. So we will be administering 1.5 milliliters of morphine intramuscularly per provider's order. I will go ahead and introduce myself to the patient. Hello, my name is Trina. I'll be your nurse today. Close curtain for patient privacy, hand hygiene. Can you please verify your full name and date of birth as I verify with the wristband? Thank you for that verification, Mr. Bob. So can you let me know if you have any medication allergies or any allergies to the environment or food? No allergies, thank you for that. So today I'm here to administer morphine injection per the provider's order, and just to give you some information, this medication helps to relieve severe pain. How it works is it interrupts the nerve signals of pain. So some side effects of this medication might be you may experience constipation. Some adverse effects that you will need to let us know immediately would be if your blood pressure is starting to drop, or if you start to experience some difficulty breathing. So for the intramuscular injection, to locate the site, we're going to do the ventrogluteal site. So we'll place the palm of our hand on the patient's greater trochanter. The thumb will face the patient's groin. Our index finger will face the iliac spine, and our middle finger is going to face the iliac crest. So the center of that triangle is going to be our injection site for the intramuscular injection. So we will go ahead and, do you have any questions regarding the administration or the medication? No questions? Okay. So we will go ahead and assess the site, make sure there is no bruising, edema, inflammation, signs of infection, bruising, discoloration, and we will also palpate for tenderness or masses. Okay, site looks and feels okay. So we will go ahead and prepare our medication. I will go ahead and hand hygiene, apply clean gloves. For this syringe, we're going to be using a 3 milliliter syringe, and the gauge will be 25, and the needle for intramuscular injection should be about, for an adult, 1 to 1.5 inch needle. We'll be using a 1 inch needle. So first, we'll go ahead and clean the vial with alcohol and discard. Now we can also cleanse our site. We're going to work in a circular motion from inside outwards for a 5 centimeter radius. Discard. So now we will go ahead and attach our syringe to the needle. Discard. Okay, so we will be drawing up 1.5 milliliters of air. Okay, now we'll inject this into our vial. Inject, invert, and now we will grab 1.5 milliliters of morphine. No bubbles. just to verify, 1.5 milliliters of morphine. So for this injection, we will be inserting it at like a dart at a 90-degree angle. We can either use our 2 fingers here to stretch the skin a little bit, or we can gently pinch to provide more muscle area. And we will inject the medication about at the rate of 10 milliliters per second, or 1 milliliter per 10 seconds. Okay, so we'll hold it like a dart. Here's our site. We'll go ahead and pinch slightly and pierce and inject. Okay, and we will also hold this here for 10 more seconds. Okay, and then we'll go ahead and straighten to sharps. We will place a gauze and apply a gentle pressure. Okay, and we'll check for no bleeding. That's good. And we'll discard gloves, hand hygiene, and document our procedure.